So again, thank you all for joining us. I am Hillary O'Toole. I'm the Executive Director of the Beaver County Marcellus Awareness Community. I'm also a resident who lives in Center Township, and I have 4 children who attend the Central Valley School District. I really want to thank all of you for joining us today. We are really excited to welcome the Environmental Health Project back to our office hours. This is the 3rd meeting that we've had. EHP is an organization dedicated to protecting public health from the impacts of shale gas and development. They will be going over our key findings from the 3rd quarterly report for our AirSense project, which is completely specific to Beaver County. And we are absolutely delighted to have someone new on the project. Let's give a warm welcome to Santosh, who has joined the EHP team. Santosh is one of EHP's new Appalachia project coordinators and recently moved to the area after living and working in Alaska. So welcome, Santosh.
Thank you for the warm welcome, Hillary. I'm excited for this call. Nice to see everyone here.
Nice to see you. And Nathan is the program manager for EHP, and his work has centered on analysis of air quality monitoring, the development of air pollution dispersion models, and the evaluation of protective policy changes. We are so grateful to have Nathan here today to share the insights from our latest AirSense report. So I'm going to hand things over to Nathan.
Thanks so much, Hillary. Appreciate that warm welcome. Evening, everyone. Happy to be here to share our results from this most recent round of monitoring. I'm going to share my slides here. All right, folks should now be able to see my slides here. So we're going to be talking about monitoring results collected in Beaver County from June to September of this year. So very much looking at summer air quality readings here. Just a brief agenda of what we're going to cover here. I am going to give a little bit of an EHP background for any of you that are not familiar with our organization, talk a little bit about the AirSense project itself and what we are doing in this project. Then we're going to get into the results themselves, a little bit of information about how to protect your health in relationship to poor air quality when that happens. And then we're going to open it up for any questions that you have. As Hillary mentioned, if you do have questions during the presentation, don't hesitate to raise your hand. I may not see a raised hand, so if you want to come off mute and start asking me your question, that could work too. With all that said, we can dive on in. So EHP, the Environmental Health Project, we're, as Hillary mentioned, a public health nonprofit that works to defend public health in the face of shale gas development. Our work takes a lot of different forms, but largely centers around data analysis, health education, and working to ensure that strong policies are put in place to protect public health in the face of shale gas development. We work on all portions of the shale gas life cycle, from extraction of gas in fracking fields to the transportation of that gas and processing in compressor stations and cryogenic facilities to its end use, which can include power plants, cracker plants, and a variety of other use cases like LNG export terminals, as well as the disposal of waste products that come out of this life cycle. Because we do a lot of work all around the county, all around the country rather, as you can see from the map on the right here, we do have a good deal of experience working around facilities that are in complex emissions situations where it's not just gas, but also perhaps steel or other kinds of legacy industries. And we are certainly looking at emerging industries like AI data centers increasingly. We work largely in partnership with community organizations like BCMAC to make our work as impactful as possible. We do not have folks on the ground in all of these places like organizations like BCMAC does. So we are really effective through our partnerships with folks like BCMAC. We also have our Health Watch program, which is a cohort-based community air monitoring model that we are doing here in Southwestern Pennsylvania as well. So AirSense itself is a project that BCMAC began just coming up on a year ago to give Beaver County community members access to real-time air quality information and resources to take action to mitigate health risks. We have 5 monitors around Beaver County that are monitoring for particulate matter, fine particulate matter, or PM 2.5, nitrogen dioxide, or NO2, ozone, and VOCs, or volatile organic compounds. This monitoring for VOCs is looking at a wide range of different compounds with one single instrument. So we are looking at total volatile organic compounds with these instruments. And that does lead into some complications when trying to articulate how much VOCs could be impacting the health of folks that are living in Beaver County. But all that said, we are very excited to present results from these high quality stationary air monitors. There is also a single mobile air monitoring unit. We are not going to be covering results from that unit in this meeting, however. There are community education resources as part of this, which includes a website with real-time air quality data, which we will be providing a link to later in the program here, and resources to protect your health from air pollution, which I will be covering a bit as well. There is another portion of this project that is looking at health monitoring that BCMAC is working with other organizations on, and we will not be covering any of that today, but that is something else to keep an eye on as that gets up and running. All right, so stationary monitoring, we're going to be looking at results from June of this year through September. We are using Aeroqual AQM65 monitors that are continuously measuring these pollutants that I already noted. And we are providing quarterly, and by we I mean EHP is providing quarterly data reports and key finding reports to BCMAC, and BCMAC is sharing them with all of you. We're also hosting these office hours. So all of that said, let's dive on in. This is a map of the area and where our monitoring locations are. Oh. We have monitors at these blue diamonds. The DEP, also the Department of Environmental Protection, has monitors at these orange diamond locations. And you can see these sort of gray cloud icons. These are Title V facilities. So these are the large facilities in Beaver County that are that receive the highest level of scrutiny from the US EPA. Then these yellow dots are smaller, called state minor sources, which don't meet that threshold for increased scrutiny, but are still emitting things into the air. We are also want to always keep in mind that in Beaver County, there are a lot of folks that we consider vulnerable populations, and there is a lot of existing chronic illnesses that leads people to be more susceptible to the effects of air pollution than they otherwise would be. We see that a quarter of residents in Beaver County are over the age of 64, and there are high rates of asthma, chronic obstructive pulmonary disease, or COPD, as well as high blood pressure, high cholesterol, and cancer. These are all high percentiles. So compared to the rest of the country, we are seeing a good bit of these illnesses in Beaver County. So this is another reason why this kind of monitoring is really important. So the results themselves. We're going to get started with particulate matter, fine particulate matter, PM 2.5. And this is a rolling 24-hour average of the 5 monitors and the readings that they were able to record over the past 3 months. We can see in the background different colors. These are the air quality index categories, which range from good to hazardous. We can see on this graph here that we only have 4 of those air quality index categories. Those are good, moderate, unhealthy for sensitive groups, and then unhealthy in the red. We can see that we also have a dotted line here. This is the US EPA's 24-hour standard, where we don't want to see readings go beyond this line more than once every 50 days. So we can see that we are going beyond that line quite a bit, particularly in the first couple weeks of this monitoring period. We saw particularly high PM 2.5 values. This was when the region was being impacted by Canadian wildfires quite heavily. And that is going to be the main driver of particularly these early June PM 2.5 readings that got up into the unhealthy AQI category. The 24-hour average values up above 80 are incredibly high, and values that should be taken very seriously by public health advocates, by residents, and by regulators. Unfortunately, since these were caused largely by Canadian wildfires, it is quite difficult to find any sort of policy solution to bring these down that doesn't involve international diplomacy at the very least. So these are hard things to control when we have wildfire-induced smoke, but it is a really important time to have accurate information to provide to communities. So these were when we were seeing really the worst readings, but also early August, we also saw some elevated readings across the network. You can see with these rolling 24-hour averages that the 5 monitors tend to move together. So this shows us that largely the readings that we're seeing are regional in scope and are going to be caused by wider patterns in the atmosphere and not necessarily local emitters that are local to Beaver County. We have a table here showing comparisons to EPA standards. So the EPA has the National Ambient Air Quality Standards that has 2 standards. One is the daily standard. This is on the left-hand column here. And we're looking at the 98th percentile of 24-hour average readings. This basically means what 24-hour average puts you in the top 2%, right? And the idea is you can exceed this value twice every 100 days, basically. So the EPA says that number is at 35 micrograms per cubic meter, and we see that 4 of our 5 monitor locations are above that standard. This Brighton Township monitoring location is not above that standard. However, that is due to the fact that the Brighton Township monitoring location is solar powered, which means that we get very few actually uninterrupted 24-hour segments of data coming in, which if we don't have a full continuous 24 hours, then that data is discarded for this table here. So that doesn't mean that Brighton Township monitor is necessarily seeing something completely different, just that it is not recording data as often as these other 4 for this specific measure. We also have the average of all readings. This is compared to the EPA's annual standard of 9 micrograms per cubic meter. It's important to note that we are looking at 3 months of data here, right? So even if we are above this annual standard, we need a full year's worth of data to evaluate that standard meaningfully. And the EPA will take several years, 3 years to be precise, to say that an area is exceeding the National Ambient Air Quality Standards. So these are not good readings for particulate matter. They are over the EPA standards for this 3-month period, but we do need more data to say that the area is out of compliance with the National Ambient Air Quality Standards for particulate matter. Really what this is saying is particulate matter was pretty bad over the summer, right? This is a seasonal trend that we tend to see in the summer. There's more activity and there's more what we call secondary formation of particulate matter during the summer, with more sunlight allowing for other pollutants to form particulate matter more readily. But we would rather see these lower, right? These are readings that are able to impact human health and should be communicated to residents. We also look at PM 2.5 readings on a 15-minute average in addition to that 24-hour average. So when we're looking at 15-minute averages, particularly with particulate matter, we can see short-term spikes in particulate matter that get sort of smoothed out when we're looking at the 24-hour average. And if you'll recall, we saw 24-hour averages that went up above 80 in early June, but we can see that on a 15-minute basis, they got quite a bit beyond 100. So these are really high readings, and you can see even when we saw lower 24-hour averages, that there were times when we saw pretty high spikes on these monitors, even though they only lasted for a short period of time. These short spikes can be high enough, even though they are short in time duration. They can be high enough to cause human health impacts like asthma attacks and hospitalizations for a variety of different reasons. So these are important to keep in mind as well. And you will be able to always see the real-time PM 2.5 values on the BCMAC website. So important to keep in mind. The PM 2.5 readings also can be compared to the EPA's air quality index, which I mentioned earlier. So the AQI is a categorization of air quality from the United States Environmental Protection Agency that includes a health guidance angle to it as well. We can see that when we are getting into this orange category, we are in unhealthy for sensitive groups, and folks that are members of a sensitive group are guided by the US EPA to take certain actions, like spend less time outside, for instance, when air quality is in this zone. What we're looking at here on the right is a pie chart that shows on a 15-minute basis what was the highest AQI category we got into on each given day. So on 12 of the 93 days, 95 days that are in this reporting period, we didn't get out of the good category, which is quite good. 63, the majority of the days in this monitoring period, the highest AQI value we saw was in this moderate category, which the EPA still says is acceptable, but there are some risks for some very specific groups of folks in the moderate category. On 14 of those days, we saw readings get into the unhealthy for sensitive groups category, and on 4 of those days, we saw the AQI get up into the unhealthy, so unhealthy for everybody category. This is not particularly good. However, I will note that this is actually an improvement from the last monitoring period, where we saw a lot more days getting up into the unhealthy for sensitive groups and the unhealthy categories. So we're seeing higher averages, so a lot more time in this moderate category, but our spikes aren't getting as high as they have at other times of the year. There is still health burden associated with that, but less of that short-term health burden for things like asthma attacks, as we've seen at other times of the year so far. All right, so that is particulate matter. I'm going to move on to nitrogen dioxide. Nitrogen dioxide is an important pollutant, also regulated by the EPA. And this is emitted by a vast array of different industrial facilities, as well as things like car exhaust. Nitrogen dioxide is important primarily because it goes on to form other pollutants in the atmosphere, most notably ozone, which is very hazardous to human health. The nitrogen dioxide values we see for this reporting period are well below the EPA standards, represented here by a dotted line. And basically, they say you can't exceed this line more than once every 50 days. As you can see here, we have not come close to exceeding that value. So nitrogen dioxide is looking good in this monitoring period and has throughout the monitoring project. We can see here that our daily maximum 1 hour readings, the 98th percentile, was 27.5 for all of the data, and only up to 29 on that Beaver Burrow monitor. We also have averages well below the EPA standard here. So nitrogen dioxide, as with previous monitoring periods, is looking good. We also are able to look at 15-minute averages as we do with all of the other pollutants. Nitrogen dioxide, though, we don't tend to see these kind of spikes that we do with particulate matter and VOCs, which we'll get to. They do tend to stay pretty close to their longer-term average readings. All right, ozone is the other federally regulated air pollutant that this project monitors for. And we can see here, these are rolling 8-hour averages, which is comparable to the EPA's standard. The EPA says that an area can exceed this standard of 70 parts per billion of ozone 3 times throughout the course of a year before being in breach of the National Ambient Air Quality Standards. And it is a little hard to tell here. We can go to the next slide actually to see this, but on all 5 of the monitors, that happened this summer, right? Where ozone exceeded that value on more than 3 occasions, so on 4 or more occasions. And this is the season that we would expect to see that happening. Ozone is not emitted by any particular facility, but rather formed in the atmosphere by atmospheric chemistry, where largely volatile organic compounds, nitrogen oxides, combine in the presence of sunlight to form ground level ozone. The sunlight is the main reason that we see more ozone in the summer. And as we can see here, we are above the EPA standards. This is not good and can be harmful to human health. Ozone is the second leading cause of air quality related deaths across the globe after particulate matter. And exceeding this EPA standard shouldn't be taken lightly. I will note, however, that Beaver has been exceeding the threshold since the 90s. So this is not necessarily something new. And I only checked back through the 90s. It might have been even longer than that. This is something that is hard to really tamp down on because of this atmospheric chemistry element. The polluters that are driving ozone formation in the given area could be, states away from where we sit. So it can be really difficult to get these numbers down. They are trending in the correct direction, but again, it looks like according to our monitor network, Beaver County will remain in exceedance of the National Ambient Air Quality Standards for ozone for 2025. The EPA will release that determination after the end of the calendar year. So that is ozone. I want to touch lastly on total volatile organic compounds, or TVOCs. These, as I mentioned, are a wide variety of gases, and it's hard to really say what level of VOCs is going to be a point where we are concerned. Unlike the other pollutants that we've looked at, we do not have a EPA standard to compare VOCs to. But we can see when they're higher, when they're lower, and do some trend analysis there to better understand what kinds of sources of VOCs there may be. An important thing that we saw on the monitoring network during this quarter was that two of the monitors, actually three of the monitors, were reporting very low values for the majority of this reporting period, values close to 0. Whereas the Rochester Township and the Beaver Borough monitors continue to report values similar to what we've seen in previous reporting periods. We are still trying to determine whether or not this is a reality of the air quality situation or whether this has something to do with maintenance that was conducted on these monitors early on in the monitoring period. I can show you here comparisons of averages for these to one another. We can also see down here at the bottom, we have all Beaver air quality readings and all AirView readings. So AirView is our data system that we use for analysis. And we can see that on 2 of the monitors, we had readings that were above the average, about twice the average. But the other 3 were quite a bit below this average of 1 part per billion. We can also see that we were not seeing all that many 24-hour average readings that got particularly high either. So the spikes in VOCs that we saw were quite short term. So by and large, this is showing us that VOC readings are remaining low as far as we can tell with this instrumentation. And if we go and look at the 15-minute readings, we can see that there are times where we see events on these monitors where readings do get quite a bit high, over 50, over 70, over 90 here. And these would be cause for further investigation in the area to try and identify potential sources. However, these are very short-lived spikes. They could lead to short-term impacts to folks in the area, depending on what specific VOCs are being detected by the instrument. I mentioned earlier, this is a diverse set of gases, and some of them can be quite harmful and some of them can be relatively harmless, depending on which specific VOC you're dealing with. So it's hard to say necessarily that any of these spikes are going to be sort of a major cause for alarm, but certainly cause for more investigation for sure. Thankfully, there are not very many of these large spikes, fewer than we've seen in other monitoring periods, but something to keep an eye on in the future. Okay, so that is high level what I wanted to share with you all about the air quality monitoring results. The main conclusion here is that PM 2.5 was quite high, okay? We had exceedances of the EPA standards. We saw that the PM 2.5 was largely driven by both local and regional sources. The highest readings seem to be driven by regional sources like those Canadian wildfires, but there were certainly times where we saw differences between the monitors that were likely driven by local sources as well. We did see high short-term exposures, albeit infrequently, lasting for 15 minutes or more, that could induce health effects in sensitive groups. And PM 2.5 is definitely something that we will continue to monitor and continue to communicate on. On the flip side, nitrogen dioxide, NO2, we saw readings that were well below the EPA standard, and there is not a major cause for concern on the NO2 front. With ozone, we saw ozone levels that exceeded the EPA standard, and if the regulatory monitors see the same kinds of readings, we would expect another year of Beaver County being out of compliance with the National Ambient Air Quality Standard for ozone. These increased levels in ozone compared to previous monitoring periods are consistent with seasonal changes that we tend to see throughout the year. Lastly, with VOCs, we saw that our total VOC levels were generally low and appeared to potentially decrease at a few of the monitoring locations. The highest levels of VOCs were recorded at low wind speeds, which indicates to us that they were likely caused by local sources, not coming in from far away. So that is the air quality monitoring data. I do want to briefly touch on some things that you can do to protect your health from poor air quality. Please pay attention to the weather and air quality forecasts. You can look those up at airnow.gov. Keeping your windows closed at night, particularly when we're expecting poor air quality, is a good way to keep yourself insulated from the effects. Using an air purifier is another great way to protect your health. And remove avoidable indoor air pollutants. We spend most of our time indoors, so making sure that we're removing any potential polluters inside our own homes is really important. And one of the best ways you can do that is vacuuming instead of sweeping to reduce airborne particles in the air. There's a variety of tools to check air quality. The one we've been talking about here, the Eyes on Air AirSense page on BC Mac's website, is going to get you real-time air quality information for Beaver County. You can also look at the Purple Air Map and the airnow.gov website. We also have some guidance on drinking water in the home. For those of you on public utilities, you can look up your provider's consumer confidence report and search for water quality information at the EWG Tap Water Database. And if you're on well water, the Pennsylvania DEP has a variety of resources available for you, as well as testing of well water that may be available through Duquesne University upon request. Surface water recommendations from Three Rivers Waterkeeper: stay away from obvious outfalls, avoid contact with water during or immediately following rain events. Now that we have a few of those again, and you can find more information at threeriverswaterkeeper.org. Lastly, keeping a health diary is always something that can help you and medical professionals try to understand what sorts of environmental factors may be influencing your health. Here's a list of resources that we can provide as well, and all of these are on the EHP website. But with that, I think we can open it up to any questions that folks have.
Thanks, Nathan. Please feel free to raise your hand and ask a question. I guess, Nathan, I have one if no one else has one right now. In comparison to some of the statistics that you put out earlier, like the asthma rates, so we're in the 74th percentile, the COPD, the high cholesterol, and the cancer, which was specifically non-skin, we were in the 97th percentile. Can you tell me, I mean, obviously, because Beaver County has been out of compliance in these areas when it comes, thank you for pulling that up, when it comes to the EPA standards, what would be something like if I currently had asthma? I mean, is there something, at the end you had mentioned close my windows at night and I can vacuum instead of sweep, and what were some of the other things, using air purifiers, things like that. But like, is there anything else I can do in terms of, like if I have kids and I feel like they're going to go outside no matter what, because they're in school, like, is there anything that we can do? Most specifically, I'm a little bit worried, like, just about the PM 2.5 and the ozone. Like, I do have a child with asthma. Is there anything that, like, or any, I mean, it's not like I can tell the school to keep, he's in 5th grade. It's not like he's, um, able to make decisions for himself or I have any control over that. But is there any guidance or anything that I could maybe take to the school to let them know? Or is there anything that I could be doing at home to like limit that exposure?
Yeah, in terms of schools, um, there are a few different things that folks have had success with. One is the EPA's Air Quality Flag Program. So that is done at a lot of schools around the country where they actually put up colored flags that denote the air quality index category that is expected to be reached on a given day. And that serves a few different purposes. One is to inform the community. For instance, folks that are dropping off their kids in the morning might not have gotten that information yet, and they can see the flag and be like, oh, okay, we're going to have bad air quality today. I might want to change my plans for the day. But then also, folks that are at the school might be able to adjust things like how they handle recess during, after lunch, particularly when we tend to see higher levels of ozone. So that's one thing that school administrators may be willing to do, and the EPA has a good amount of information on that, actually on the airnow.gov website about the air quality flag program. Um, you know, Unfortunately, when you're talking about young kids, you're right that it's hard to get to get young kids to sort of understand the importance of air quality and sort of change their behavior in meaningful ways that are going to reduce exposure. So making sure that they have rescue inhalers and all of that, if they already have asthma, is really important. And there are a variety of personal monitors as well that are coming to market. We don't have much experience with those here at EHP, but those tend to be, well, some of them are real time, some of them you need to analyze after the fact. But I know some personal monitors can be set to sort of give you a ding if the air quality that they're sensing, it would be like something you would attach to your jacket or something. They could set to ding when air quality was poor, and maybe that could be the kind of impetus for a kid to be like, okay, like let's go sit down instead of running around in the field at recess. But I certainly love to hear anyone else's success stories of getting, elementary, middle school age kids to do much of anything. I'm afraid I am perhaps not as well versed on that front as I could be.
No, I agree with you there. So that's kids. I guess adults, we should be aware of this as well. So that would be the same kind of thing. Limit our outdoor time during these high ozone days, and always check the monitors for ourselves and make sure that we know when we're stepping outside, like it's safe for us. If we have asthma, like if the adult has asthma.
Yeah.
Obviously, PM 2.5 would fall into that category as well. You had mentioned that, but is there like a safe, like if you want, the soccer game is going to go on, so you still are going to be outside for like a set period of time. Is there like any type of safe, 1 hour a day, or is it really like limit as much of this exposure as possible?
Yeah, so it depends on how how bad it is, really, right? The AQI categories do tend to have a good amount of detail in terms of suggestions for how to adjust your behavior if you're, for instance, in the unhealthy AQI category. They will tell you if you are in a sensitive group. If it's in the unhealthy category, you should really limit all time outdoors. And they may give you a specific number. But for folks that aren't in a sensitive group when you're in the unhealthy AQI category, they basically say, you know, as long as you're not doing anything strenuous, it, you know, isn't necessarily going to be immediately detrimental to your health. So if you're going out and sitting, you know, in a stand, I would maybe cheer at the most exciting moments and just otherwise try to stay cool, calm, and collected. But you know, really, when we're talking about particulate matter and ozone, what you want to limit is active outdoor time, right? So if you're going to be, you know, running, if you're going to be exercising, if you're going to be doing sort of strenuous yard work, that kind of thing, then that's the sort of thing that you might be like, okay, maybe I'll do the mulching tomorrow instead of today, right? But I will see if I can get some of that more specific AQI guidance and put it in the chat here.
Thanks, Nathan. Not trying to put you in a position, just trying to
Oh, totally understand, yeah.
try and understand all the ins and outs. Anyone else have a question for Nathan or us about the project, any of the outcomes, any of the other reports?
Right, so I'm putting in the chat here a brochure from the EPA about the AQI. I apologize because it's a bit long, but it has guidance for each of the different criteria air pollutants. So each of the different federally regulated pollutants that relate to the AQI. So you can, if you hear, okay, we have bad air quality today, and it's because of particulate matter. They have specific guidance in that document for that situation versus ozone, for instance. They have the ozone guidance in there, as well as carbon monoxide, sulfur dioxide, and nitrogen dioxide. So that's sort of a one-stop shop for what the US EPA at least says you should do under different circumstances.
That's great. Thank you so much for that.
So in the chat, Milton asked, are you doing anything with the info from the purple air monitors on our homes also? So Nathan, I don't know if you want to talk about how EHP supports Project Spotlight.
Yeah, so, oh, I apparently closed the window and now it's stopped sharing. All right. So this project itself is relying on those high quality air quality monitors that are quite large and expensive, and we only have a few of them. But EHP is working with BCMAC as well on Project Spotlight, which is deploying a large number of purple air monitors across Beaver County and I think a bit into Allegheny County as well. I don't know if there are any other counties necessarily included there, but we are providing similar analysis tools to what you've seen used here to the folks involved with Project Spotlight, so to BCMAC and other project partners, to do a similar kind of analysis. Now, those monitors are looking largely at particulate matter, right? But this analysis can be done with those monitors as well. So We have provided that analysis platform to BCMAC and the Breathe Project for analysis of those purple air monitors, and continue to provide support on looking at that data. That is a project that is going to be continuing for quite some time. So that will have a good amount of data by the time we're done with it, and from a much larger number of monitors than we have here. I've been looking at purple air monitor results from Beaver County and from southwestern Pennsylvania more generally over the past week or so, writing up several different reports for the region. And I can say that the purple air monitors are basically saying very similar things to what these AirQual monitors are saying, that air quality over the summer has been pretty bad, but it has largely been sort of a consistent higher average, sort of higher background, if you will. And we're seeing not so many of these high short-term spikes that we do tend to see, particularly from local sources of particulate matter. So really, it seems like the whole region, all of southwestern Pennsylvania, northern panhandle of West Virginia, and eastern Ohio has really been seeing pretty bad ambient particulate matter this summer. And it's not been very straightforward to try and say exactly what is causing that outside of the times that we're being impacted by wildfire smoke, unfortunately. But it has been a pretty bad summer all around on the PM 2.5 front. Is there anything else that Hillary you think I could mention there?
Well, I was just going to say, I do want to bring up, we are so blessed that we have many different ways we're monitoring the air in Beaver County right now. So we have our AirQual monitors, we have our purple airs. Through Project Spotlight, they're doing episodic samples, and we are also working on the next phase of AirSense, which includes a community-led health study. So phase 1 of this actually rolls out this weekend, where we will be installing passive samplers actually right outside people's homes. And what this allows us to see is when we're looking at these reports and we see TVOCs, total VOCs, with these monitors, we will actually be able to analyze them for the specific compounds. So it just won't be an overall VOC number. We'll be able to say what exact VOCs we're seeing and what those levels are outside of people's homes. In addition to that, we're going to do some indoor air monitoring, where we'll be able to do the same thing. So we're trying to see how is this affecting your home, your households, and eventually your body. So we do have a piece of this study that'll happen in 2026, where we will likely be doing some type of blood prick to see what PFAS are in your body. And our hope is, with all of this data together, we can figure out what is the next step we need to do to push for change, for regulatory enforcement, for policy changes. We really need all of this data to, push the decision makers, and we're seeing that work so far. So I'm going to drop in the chat the sign up for our health study. I know there's some people on this call who are already a part of it, and that's very exciting. But we are looking for more people who just are interested in whatever we, decide to do. We have to get what's called IRB approval for certain steps. So, that might take a little bit more time than the outdoor passive monitors we're installing over the next couple weeks. But we are really trying to listen to what people have said to us, find solutions, and bring them along. So I dropped that link in the chat. We are going to be doing a really big marketing push in the fall and winter. And if anyone has ideas on, how do we get these quarterly reports that EHP has done such a great job, how do we get those out into the community? how do we communicate to your neighbors or people that might not be interested in this or know it happens? So if anyone ever has feedback on that, I will put our email address in the chat because we're always looking for new ways to share information.
Thanks so much, Hillary, for sharing that. And just, the piece that I think we need to translate here is that BCMAC is not doing this or leading this study. This really comes from the residents of Beaver County saying, hey, nobody's doing this. No one is taking a look to see if we're being harmed in this way, or if our bodies are absorbing any of these things. So we are working with the University of Pittsburgh School of Public Health and Dr. Jim Fabizak, who is on vacation right now, or else he would be here. He hasn't missed an office hour yet. But we are very appreciative to them and EHP just for all of their work and all of their help in really bringing these resources to Beaver County so that we can provide this information to you and to us, and we can have it and make decisions for our health, knowing that we are leading the path. And we're making decisions for projects and work that needs to be done based off of what we know our community needs and where the gaps are for us. So just Nathan, thank you so much again. If no one has any questions, I'm just gonna conclude with just a quick update on BCMAC and our work. So there are 2 opportunities to join us next week. On Tuesday, we'll be having another Decoding Shells Permits Defending Our Future event. But this time we're going to hold it at the Conway Fire Hall. Everyone is welcome to attend. And if you've attended in the past, we'll be sharing the exact same information, but to those of you who were there last night and we were talking, a lot of times conversations can lead into new shared ideas and information. And so we would honestly love to welcome you there again. Sometimes it helps when we're offloading a bunch of information that can seem kind of heavy to hear it a second time, and maybe bring a friend or a partner with you when you attend so that we can continue to pass the word along and spread the message. So on Saturday, we will be joining in Rochester to sponsor Back on Track, which is a mutual aid concert for those affected by the train derailment. All funds are going directly to the impacted residents. There is no anything behind it that's going to be receiving any of the dollars. It's going to be a lot of fun, so we're hoping to see you there. And then we have 2 more events on Tuesday. One on Tuesday, September 30th at 6 p.m. is the Conway, and then on Saturday at 4 p.m. October 4th at 3 p.m. in Rochester. But really, if you want to know about any notices of violation that Shell receives from the DEP or any malfunction reports that, show up on the DEP website over, the next few days, joining our social media or following us on Facebook, Instagram. We also have an X account. I mean, we update everywhere, but Facebook is really where we have the most interaction with our residents. It seems to be the easiest way to communicate with everyone. So Hillary is going to drop that in the chat. I don't know if she has already. I'm sorry, I can't see that part of my screen. But also please sign up for our mailing list so that you don't miss any announcements when it comes to the upcoming public hearing information and the draft permit for the plan approval D. And I'm sure Hillary is dropping all this in the chat. And then also, please just, if you can, follow us on Facebook. And Hillary has put the link in the chat. And if no one has any final questions, we will hop off. I want to thank Aaron and Santosh again. Thank you so much for your work and for bringing this information to Beaver County. We honestly couldn't do it without you. We would have absolutely no idea how to quantify this data. So thank you so much. Everyone have a great week.